Hello, welcome once again to Adonai Radio, and this is Moment of Truth. We are glad to come to your homes and your offices and wherever you are with our programs to empower you. This evening, we're going to be talking about stroke, a health condition. I'm your host, David Body. My co-host is out of town, but she sends her greetings. And I have here wonderful guests who will introduce themselves. Welcome.
Thank you.
Would you please introduce yourself?
Thanks a lot. I'm Prissy Kumson, and I'm a nurse by profession. I work in nursing leadership in population health, and so managing diseases with patients in the community and helping our providers in the community meet their quality measures and benchmarks.
Thank you. And Deacon, could you
Thank
please
you. My name is Deacon Nicholas Gatti. I'm also a nurse by profession. I work here at Mesta Washington Hospital Center, which is here in DC, and I'm into management. I manage a medical intermediate care unit, and I love my job.
Thank you. Thank you. For the past 3 weeks, we've been talking about health issues, and these have been our guests. So if you've been following us, you know them already. And if not, you're welcome to the show. Today, we'll be talking about stroke. And so the first question I will ask is, what is stroke? Any of you can pick it up. Who would like to pick it up first?
I think this time Deacon would like to go first.
All right.
It's been ladies first all the time. This time the guys are going to. Okay. Yeah, but maybe I'll answer your question before. Let me just take something from where we ended last week. Mm-hmm. I think last week we spoke about medical terminologies. And one of the issues that came up was where Dr. Kumsin came up with mammography and mammograms because of breast cancer. And I think we had a very good time with that topic.
Yes, we did.
Interestingly, I picked up that one today to bring it back here because we forgot one thing, that men also do actually get breast cancer. And I had a rude awakening on that because just this week, I had a patient on my unit, a man who had a stage 4 breast cancer.
Wow.
Unfortunately, he probably won't make it. And I wanted to just let the men out there get to know that though it is rare, it is very rare, it actually happens to men as well.
Wow.
Thanks for sharing with us.
Good. And to go to your question, today we are talking about stroke, of course, and I believe talking about stroke is appropriate because it is very common in our community. In fact, blacks are more likely to get stroke than our Caucasian counterparts or other races. And so it's something I believe that bringing it to your home is very appropriate tonight. And I want everybody to, take one or two from here. I mean, who knows? So, stroke basically is a condition where the blood supply to your brain is impaired in one way or the other. There are several ways that would happen. I believe we'll delve into that. But just basically, as a generic definition, it is impairment of blood supply to the brain or part of it in such a way that the part that is affected begins to die. And if it dies, then the part of the body function that this brain part controls will be affected as well. So we'll talk, I believe we'll delve further into that within this hour.
Thank you very much. Dr. Prissy, you want to add anything to it?
Yes, it is. Stroke is a medical emergency. Okay, it is treatable. It is preventable in a lot of cases, but when it happens, the time that it happens, when it begins, how long it lasts, are very, very critical. We have to pay attention to those. Whenever you see that someone may be experiencing a stroke, and we will get into that, you need to know that it is a medical emergency. And if not treated, it could lead to death or permanent disability.
I like the fact that you said whenever you see that somebody is having a stroke. So how will you know? What are the signs and symptoms for you to know that someone is having a stroke?
Yeah. So there are a couple of symptoms and signs that come along with it, and being able to identify those symptoms and those signs could be life-saving for yourself or somebody else that may be having it. So first of all, the person may have difficulty talking or even understanding. You will see them having, like when you ask them to smile, they might have a slurred speech, for instance, because it is a condition that happens as a blockage of blood clot into the brain. People have difficulty just talking and just understanding. And so you may ask them to say something and they cannot even get it together. And you know that this is a person that never had a problem with speaking or with talking. So that's one of your first things. You know, if I say, how are you? And then you're having a lot of trouble saying it, that is an indication that person may be having a stroke. You can also see, or you will see, numbness or paralysis on the face, the arms, and the legs. Now, you say you will see one side of the face may droop a little bit, or it can happen on either side. It usually happens when there's paralysis. It usually happens on just one side of the person. So it could be their left side, it could be their right side. So, and that numbness of the face, and like I said, sometimes you see that slurred speech is very classic. It's a very cardinal sign of stroke. You will also see difficulty seeing in one eye or both eyes. The person may have a blurred vision, or even blackened vision, that they see that things are black, or they could even see like double. You know, you see like 2. It may be a sign that the person may be having a stroke. Another symptom is the sudden severe headache. You know, it comes on you suddenly, and it's very severe, and is accompanied by dizziness, altered consciousness, even vomiting, because vomiting.
What is altered consciousness?
So your conscious state, you're not there. You're not all there.
You feel like you're passing out?
Not passing out. Passing out, feeling like you're passing out, just like you're feeling dizzy, but your consciousness is also, you're not, when we say somebody, you're not aware or you are disoriented, so to speak. And you may even have vomiting. You know, vomiting is often a sign of something going on systemically. You may have that alongside with a severe headache. And there is something else that you difficulty walking. So along with a headache where you get the dizziness, it flows right into your difficulty in walking. So a person cannot maintain their balance, or they cannot even maintain coordination. You know, like when you're walking, you are able to coordinate your steps normally, but you will see that this person may have difficulty just walking, period. A combination of all these signs and symptoms will alert you that you or the person exhibiting these signs and symptoms may be having a stroke.
So, yeah, go ahead.
I wanted
to just piggyback on that in terms of, you know, bringing it to where doctor has brought it up to. It leads you to be, you know, it puts certain things in place for us to be able to identify the signs or the symptoms that are coming up if somebody is having a stroke around you, right? So there is an acronym that which is used universally, which she's actually touched on every one of them, but I just want to give you that acronym that it's just like hard and fast rule of trying to see if somebody really has a stroke or something, right? So the acronym is FAST. Think about the word fast, because you have to act fast when somebody's, you know, getting a stroke or have a stroke. You have to really act fast. I can't stress that enough. In the medical field, they will say time is brain. Every time that you waste, you are losing brain. The brain matter. So you have to act and act fast. If you are going to sit at home wondering whether is that a stroke, what is happening to me, everything, you know, doing all that kind of going around and stuff like that, you are losing precious matter, which is the brain, right? So the deal is to, you know, be fast, act fast, and use that same acronym to see if that person has a stroke. So you are thinking about it. First, F means look at a person's face. Do they have a droop on one side, facial droop? If you can see, it's not even obvious, just ask them to smile. And as they smile, you see that one side of the smile is, down than the other, That would give you a little picture out there. The A for fast stands for the arms. Ask the person to stretch both arms like that on the same level. If one suddenly drops like that, they can't maintain it like that. One side of it drops. That is a quick sign right there. And the S is for
speech.
Speech, yes. They might ask them to say something. I mean, give them some basic, simple sentence to say back to you. And you see that if they have a slurred speech, something like
Very
that,
classic.
The words are not coming, all that kind of things. You see that. And basically, usually you know these people. You know that that's not how they are. That's not the way they speak and all that. So that is the quick things to, pick up to act. And the T means time. Time to call 911. Don't try to be a doctor and do this and doing that. Call 911.
Yeah.
Call your emergency wherever you may be. I mean, it's not 911 in every place around the world, but whatever your emergency line is, please call that time because that is time to save life.
Yeah, I like it when you say it is time to save
I was
life.
about
Because
to ask, when do you see a doctor when you see some of these things? And he just said it.
Yeah, and it's very,
so.
it's sometimes, when people are experiencing certain symptoms, they're not sure what is going on in their body and they want to wait a little bit and see, what is this? What is going on? When you see these things, whether it is you yourself or whether it's somebody else, don't wait. A stroke is a medical emergency. You have to get help. Don't wait to see are the signs going to calm down, because when you experience these, even if they stop and they don't persist, you still have to get help, because it could be this alert. Your body is telling you that something is about to happen. Something severe may be about to happen. Don't disregard them. It is very serious. It can be very fatal, and it can really cause permanent disability.
Do you mind if I add something to that?
Go ahead.
Because just to continue what
lot.
Yeah. So again, everything we have said so far is about full-blown stroke, full-on stroke. So it's not always like that. Sometimes it is what they call transient. That means it comes and goes. It comes briefly and goes. These signs we have said, they can come, and then before you call the ambulance to get here, they're not there anymore. That is called mini stroke. That is called, in the medical field, they say TIA, transient ischemic attack. It's just like stroke, but it comes and goes. And don't think that because it's gone, I'm okay, then forget about it. That is that warning sign that Dr. Prissy talked about. It is time to call your doctor. It is time to, just call the ambulance. And what I want to stress here, though, is that we know ourselves. We know who we are, how we behave. And if you see these signs and something is just not right in you, don't say that, well, I'll be fine, especially we men.
The man.
Yes, please. Don't say that, I'll be fine. It's good to call, and when they go and it's negative, everything is negative, it's better off than not calling.
Yeah. Better safe than sorry.
Yes. So what are the causes? What leads to having a stroke?
Yeah, there are a couple of causes. Deacon actually just touched on one. The TIA, or the mini stroke, is a temporary situational mini stroke that can actually lead to a full-blown stroke if it's not taken care of. There are a few others. We have what we call the ischemic stroke. And ischemic comes from the word ischemia, meaning reduction of blood flow. And that happens when a blood clot forms in the artery or one of the arteries that lead to the brain. That can lead to a stroke, because what happens is that brain cells begin to die, and you could suffer the permanent disability. Now, ischemic stroke is, we have two types of ischemic stroke, and the first one is called thrombotic stroke. Thrombotic comes from the word thrombos, and thrombos is a blood clot. So thrombos, last week we learned about medical terminology. The medical terminology for blood clot is a thrombus. And it happens when you have a blockage or the blood clot blocks or plugs the artery that leads to the brain to supply blood to the brain. Usually, the blood clot will form when you have a damaged artery. And the damaged artery happens when you have a buildup of plaque, and plaque is fatty deposit. We talked about body fat before, and exactly, the system is connected, and these fatty deposits will build up in a damaged artery and then cause a blood clot to form there to block or interrupt the blood flow. So that's thrombotic. We also have the other type of ischemic stroke, which is the embolic stroke. And the embolic comes from the word embolus. So an embolic stroke is when the blood clot, so it's still a blood clot, but at this time the blood clot forms away from the brain. Okay, so usually it will form in the heart. And so when a blood clot forms in your heart and then it finds its way, so it's going to travel through your bloodstream, up into your brain, and then lodge itself in a narrow artery leading to your brain, it will cause what we call the embolic stroke. And so you hear the medical terminology embolus, and oftentimes it is not a good word because blood clot is not good news. But when it's caught early, the person has better chances of survival. And now, a lot of the strokes that happen are ischemic. In fact, about 80% of the strokes that people experience are often ischemic.
Which is again?
Which is
ischemic again is?
Ischemic is, so it comes from the word ischemia, which means reduction of blood flow. And it is the blood clot that is causing, that is blocking your arteries, that is causing the reduction of blood flow.
Maybe when I add this, it might make it a little clearer. But yeah, she did rightly articulate one type of stroke. So we have more than one type of stroke. Since she says this is one of them. So ischemic stroke is the majority of all the strokes you see. That is, she said 80%. Yes, it's even higher than a little. Some put it 87% of all strokes are ischemic stroke. But then what makes up the others? There is the 13% or 15% or 20%, whatever the statistics will say, is also the majority of those are called hemorrhagic stroke. Hemorrhagic, which means there's a bleed in the brain. That means an artery or the blood vessel taking blood to the brain ruptures and leaks the blood and all the content right directly into the brain, which should not be the case. And if that happens, of course, the blood is already, somebody is trying to deliver water to your house and the pipe is ruptured somewhere. The blood will not get to where it's supposed to go to. Yes. So that is hemorrhagic stroke. That is also, of course, very much less common, but it's much more difficult to deal with. There isn't so much you can do with hemorrhagic stroke. There isn't so much you can do. It
can be very fatal quickly.
So yeah, it's something you have to watch. But the thing about it is that it is caused by two things, right? Two things. If you have, last week you were not here, but we talked about aneurysms. And if you have aneurysms, they are generally regions of weakness in the blood vessels that eventually becomes out pouches, And when these things, burst or break up, ruptures, it leaks the blood directly into the brain. So that is aneurysm will cause that. The second one is called AVMs. I don't want to go to the big words, but arterial, with the malformations. AVMs are also common, and they will also cause hemorrhagic strokes. There is another set of stroke, type of stroke, which is called cryptogenic, which you don't hear about because it is very rare. And that is a kind of stroke where we have done every test and under the sun, and we don't know what caused that stroke. So that is also there. It's very rare, but it's also there. I don't know if you want me. Okay, let's go on. I mean, I'll
Oh, if
some
you
of
have
those
something
things.
to say, you have something to say, add it.
Please.
I just wanted to say something about.
Because your talking is making me think about something, but you finish what you want to say.
I wanted to
and then
say something about this. We just make mention of the fact that hemorrhagic stroke is a little difficult to deal with. But maybe when we go on to how to deal with this stroke, we can talk.
Okay, okay.
Yeah.
So the question I have right now is, so we've talked about all the causes, but my question is there anything people can do that will put them at risk of a stroke? Or is it just because of maybe genetically it runs in some families? Is there anything like people can do that can put them at risk, or is it just a genetic condition?
Yeah, there are things that we do as people that put us at risk for stroke.
Tell us about that.
And then there may also be some things that we can't really control, but even with those, you can still,
Manage.
do some things to kind of reduce your risk factors. So the first one that I want to talk about is overweight and being obese. We talked about body fat, right?
Yeah, we did.
Yeah.
Yeah, back to it.
Yeah, back to
Connected.
it. Exactly. They're all connected. Being overweight and being obese is a risk factor for stroke, and that is why we encourage those lifestyle changes that can help reduce your risk. Also, not being active, just period. Being sedentary. We have something called having a sedentary lifestyle. So you cannot sit at home being idle all day, laying on the couch, not even moving around too much, even in your own home or even outside of the home. That high level of physical inactivity will predispose you to getting a stroke.
Is it possible people go to work by ourselves that considered inactive? Because you said if you stay at home
driving.
the whole time. So is there like you are not at home the whole time, but you are still considered inactive? Is it possible?
Well, you can be home and be very busy.
Or you can
Very
be out
busy
of the home
at
and
home.
still be
Yeah, because you have
inactive?
to move. The inactivity is movement. Whatever the movement is, if walking, running, jog, whatever that activity is, So we have people. We go to work and sometimes we don't have time to exercise. Well, we are doing a lot of movement. Okay, that you're moving.
Oh, so
Okay,
if
so
you're
you're
at the
not
desk
just there
the whole time.
Exactly. You can't be a couch potato. You can maybe be a couch potato for like a little bit, maybe watching a movie, but you cannot be a couch potato all day, 24/7. That's not. And where we see that is when we have people who are obese, and therefore movement is a problem. It's very difficult. They sit at places for longer periods of time. They order food, so all they're doing is really getting up to the door to maybe open the door for the pizza guy or whatever delivery is coming. So they're not doing much of any movement at all, and that can be very, very dangerous. Okay. Also, heavy drinking. People who drink too much, it can cause a lot of problems. We know about the problems that it can have on your liver, but it could also have an impact on you being at risk for having a stroke. Okay. Also, we got to talk about this because in our community, we don't know what is happening in our community. We have to attack everything. The use of illicit drugs can also be a risk factor because illicit drugs like cocaine, they constrict the blood vessels, and that could be a risk factor for stroke.
So yeah, to continue from where she left off, don't forget that she started by saying that these are lifestyle modifications, things that you can do. Obviously, you touch on parts that just genetic. We're born with it. I think from the beginning I said that blacks are more likely, more susceptible to stroke than our Caucasian counterparts. So we are talking about the parts that you can control, and I want you at home to think about that there are things that you can do. I mean, we didn't even talk about smoking. Smoking is one of the big ones. I know this platform, smoking may not be, very popular here, but it is there. Smoking is one of them. We have to think about that. And also, we have to think about some medical conditions that predisposes us. We might have some medical conditions that that makes us more likely to get, stroke. Think about diabetes. We talked about diabetes last week or the week before.
Yeah.
So
Both
that
Both
puts you at a higher risk of getting stroke. People, they have a condition of the heart arrhythmia called AFib, atrial fibrillation. That also puts you at higher risk because under AFib, the heart is quivering. It doesn't contract and expand like it should normally do. It goes that way, so it pulls blood, and that increases the chances of developing a clot. And when that clot leaves the heart, where is it going? It's going out there, and it could end up causing stroke. So if you have AFib, by all means, your doctor should know about it, and they will put you on the appropriate medications to control it, or anything that could be done to make it, to take care of it, that should be looked at. And so if you have any medical conditions that you've been told, it's better to make sure you stay on top of it, because those things can also lead you or predispose you to stroke.
So there's this question about stroke. Before we go on, just so I don't forget. Okay. Yes, this, so about stroke and seizure, is it related? Like you think somebody's having a seizure because they're just ill, or they're just... what can you say about seizure and stroke? Are they kind of related, or are they two different things?
It's interesting. Yeah, we'll say no, and then later I say yes.
Yes and no.
Okay, tell us about the yes and about the no.
Yes, because stroke itself, when somebody gets stroke, they can, subsequently they could be getting seizures. Let's say you have hemorrhagic stroke. All this blood has leaked into your brain. It predisposes you to, get seizures.
Yeah.
But the symptoms are not the same. They might look the same, but a trained eye knows that they are different. Okay? So usually seizures have, when somebody is seizing and they are jerking, for instance, it's usually both sides.
Okay.
They go together. For a stroke, typically it's on one side of the... Yes, so there's very subtle symptom differences in there. Let me also put it there. That's why we say yes or no. There's a kind of stroke, very rare, brainstem stroke, which presents symptoms which is also a little similar to seizures. Because that one, because it's on the brainstem, on the lower brain, it affects both sides of your body. So I will not go into that, but then... But they are not, the symptoms generally, in general terms, they are not the same.
And because there's that question about stroke and seizure, for the women, there is a condition called preeclampsia. I actually wanted to talk about that last week. We didn't get a chance to get to it.
Well, we have a chance.
Yes. But preeclampsia is pregnancy-induced hypertension. And some women will get that in the course of their pregnancy. Usually after the delivery of the child, it resolves, but sometimes it does not resolve. In some women, it does not resolve. And if that condition goes untreated, that could progress to what we call eclampsia, which the preeclampsia now leads to seizure. So a person, we actually had a situation like that, where a lady who had just given birth had preeclampsia and did not know that she had it because, once again, it is hypertension, pregnancy-induced, and therefore you don't experience any signs at all. So she wasn't aware that her blood pressure was just skyrocketing, and she seized in her sleep, and that was it. Yeah, so... In certain cases, like Deacon said, the scenarios are different, but in certain cases, like in the case of preeclampsia, that could lead to seizure.
Yeah. So the causes of the two are different.
Yeah.
Seizures can be caused by a whole different set of things, so totally unrelated to what causes stroke.
All right. Thank you very much for that clarification. So we're about to the factors, the things that people can do that would put them at risk of having a stroke.
Yes. So Deacon started with medical conditions. He talked about diabetes, uncontrolled high blood pressure.
Yes.
People, high blood pressure is not good. Okay, it is. And the thing about high blood pressure, it is so preventable.
Really?
It is so preventable.
What is something you can do to prevent it?
Diet, exercise, maintain a healthy weight.
Low salt.
Oh,
What you say, Deacon?
I said low salt.
Low
Well,
salt, yeah,
food is
food,
full of
foods
salt.
low in salt. You know, the worst thing you can do is to put salt, like
Table salt. you mean.
the salt shaker, directly on your food and eat. But usually, a lot of times, people who are consuming a lot of sodium is not even coming from the salt shaker; it's coming from the processed foods. It's hidden. So you don't get to see how much salt that you're eating, but you are getting a lot of salt from canned foods, processed foods. But uncontrolled high blood pressure can be one of your worst enemies, and it could lead to a stroke. Also, there is a condition called obstructive sleep apnea. And sleep apnea is a disease we commonly found with people who are obese and overweight. You see overweight and obesity, comes into our conversations a lot, and so the weight control.
It's like a thread through it.
Yeah. Controlling your weight is very important. But sleep apnea is a sleeping disorder where you see that during the night when a person is asleep, that the level of oxygen drops intermittently throughout the night. That could be a risk factor for that. Also, if a person has had a stroke before, they are at risk for having it again. Or if there's somebody in their family who's had a stroke before, they can have a stroke again. The TIA that Deacon mentioned, if a person has had it before, remember that is a temporary situation, so you don't get a permanent damage from TIA. However, if you ignore those symptoms, that could lead right straight into a full-blown stroke. So
I'll give you some statistics on that.
please.
Yeah, so that's TIA is something that we have to watch very well because it comes and goes and you just throw it off.
What again did you say is TIA?
Transient ischemic attack.
Okay.
So it's just transient. It's just temporary.
Temporary.
Yeah.
But 15% of all strokes, ischemic stroke, are preceded by TIA. In other words, that person would have had TIA.
Which is a mini stroke.
Yes, a mini stroke, which they didn't do anything about. And then later you're going to get a full-blown stroke.
Yeah.
So if you have TIA and you don't deal with it, most likely you are going to get a big stroke. In fact, they said about 40% of people who have been treated for full-blown ischemic stroke report that, oh yeah, I think I felt something unusual before, sometime ahead of that. So that is very important. But 25% of all people who have TIA end up dead in 1 year. In other words,
1 year?
In 1 year. Maybe not, for some reason, 25% of people who get TIA, they may be dead in 1 year. It could be from stroke, it could be from something else. But those are signs. Look, the things that will cause stroke, which is a clot, let's say the ischemic stroke that we're talking about, is the same thing, the same process that causes heart attack or cause PE. So once you get that blockade, then system going on, that imperfection, it can go into other systems. So that is your way of saying that it's a warning sign that I have to, sit up, talk to my doctor, do the right things, and get all things in place. Full-blown, head-on, active, work.
Yeah.
Otherwise, what is coming ahead is, you've been shown the warning sign.
Yeah.
So we have heard about how the mini stroke looks like. Like you have a stroke, but you feel well within a short time. Do not ignore it. So make sure you go to the doctor because what might be coming next might be bigger.
Worse.
And then it might be a permanent damage.
Yes.
So please don't take it lightly or for granted. Could you just tell us one more time what we will notice if somebody's having a stroke? Just one more to refresh our memory.
Yes. So the quick one is the FAST.
Acronym?
The acronym FAST. So you think of stroke act fast. So FAST, F-A-S-T. So F stands for face. So you want to ask the person to smile. And if you see that they're drooping on one side, that's a quick sign. So arms, you ask them to put their hands above their head, or even just stretch it out. And if one hand drops or just can't maintain the position, that's a problem. And then speech, you ask them to say something, and they can't. This is a person that talks normally fine. They don't have any speech impairment, and they can't say it, or what they're saying just doesn't make sense. That is your sign. And the time. You see any of these things, you are calling 911, and don't leave the person. Make sure you stay with the person until help comes. So when you think fast, and that acronym is very easy to remember. Just face, arms, and speech. You are looking for one side drooping of the face. You're looking for the weakness on one side, so the arm dropping and not maintaining, and then the speech being just not normal.
Thank you. When Deacon was talking, he talked about those who have mini strokes within a year end up dying like 25%, which is like 1/4. 1 out of every 4 person. So tell us about complications. What complications do you think happen after a mini stroke or after a major stroke for that to be leading to a life-threatening situation?
So mini stroke, as we have said, will come and go away. So you probably won't see the complications, but let's say the biggest complications after a mini stroke is a real stroke.
Right.
So let's look at post-stroke. After stroke, what happens to you? What complication would you find yourself into? Number one, we know that your whole paradigm is changed. Your whole life is changed. Could be changed by stroke. Let me put it that way.
Yeah.
First, you could be paralyzed on one side, and or on both sides, in a way that you cannot do the things you do again. You will need people to help you to do the normal things you have to do for yourself. Of course, extreme stroke, you can die. Extreme stroke. So that is the biggest complication, right?
It is.
Dying out of
It
stroke.
is.
Yeah, being dead. Yeah, so extreme stroke, you will die. If you are not dead and you are here with us, there are various levels, right? You could be bedridden, totally bedridden, may not, get up again. That is complications, right? It could be that you lose, some of your, functionalities as a human being, because, remember we said that blood supply to certain part of the brain is impaired. In other words, the big brain that we have there, every part have the part of the body that they control. So if, let's say, the part that controls your speech is affected, then you may not be able to speak. Your speaking is going to be impaired. You may not be able to speak. You may not be able to say words that people understand or hear you. You may even not understand language.
Yeah.
Language. You don't hear people. You don't understand people. You talk to somebody. They talk to you. You can't understand. You talk to them. They don't understand. So there are several ways. If it's about your movement, it's about your hearing, it's about your sight. Whatever part of the brain that is affected will be affected. Okay. So those are complications. People with stroke obviously can go into depression. People get depressed. People get depressed. They don't want to be dependent on people, and now they are dependent on people, and they get depressed. They can't handle that. It's not easy to deal with that. So that is another thing you have to look at. Don't think about. Don't forget things like the fact that maybe you are the breadwinner of the family, and this thing happens to you, and even though you got a stroke, the whole family is going to suffer.
Right.
That is a huge thing we should be looking at. There are things like people have some pain with it. Initial pain, it goes away after a while though, but there's some pain part that people talk about, which comes with stroke. What other complications are we talking about
Yeah,
here?
they also have, there's this situation where they have extreme sensitivity to temperatures. So like extreme cold, I think it's called the central stroke pain or central pain syndrome, something like that. It's a situation where a person who has suffered from stroke has extreme sensitivity to temperatures, and that is one of the complications as well.
And the people personality change. Your whole personality can change after stroke. In other words, you were the bright, sunny, smiley person.
Bubbly.
After stroke, you could be irritable. You get angry easily.
Yeah.
Your emotional state changes. You could be a different person totally altogether.
Yeah.
After a stroke. So those are things we want to keep an eye on.
So if somebody has had a stroke around you and they have changed, you need to be supportive, right? Because every sick person has a change in personality. So do not, although the person goes about doing normal things, and sometimes because stroke takes a long time, people get used to somebody having a stroke, and so they forget that that person is still not feeling well. Although they've been like that for a while, it doesn't mean that they are now comfortable with it. So let's learn to be patient and accommodating and compassionate. So is there any...
I'm sorry.
Go ahead.
I think you make a very important point. I'm
Yes.
sorry. Yeah.
We
make
got
a
to
very
touch on that for a
point
minute.
that we
Yeah.
have to talk about.
Right.
That it says stroke takes a long time, right?
Yeah.
I think we should talk about the positive side of it too. I mean, it's not all gloomy. A lot of people, yes.
Thank you.
A lot of
Can there be a positive side? Tell us about the positive side.
A lot of people get stroke and they totally recover, right? A lot of people get stroke and they are, by God's grace, they are up and going again. And so we all want to hope that that is what happens to us, if at all, should be that kind of in our loved ones. This is because sometimes the stroke doesn't totally cure or kill permanently the nerves that they affect. So they tend to recover. The thing with neurons, which is the brain, which makes up the brain and the central nervous system, is that even if they regenerate, even if they grow back, they grow very slowly. So people can recover, but we don't know to what extent they will recover. So, like you said, it takes patience. We have to be caring and supportive. And in this, day and age, there is acute rehab, which, physiotherapy, occupational therapy, they help these people to, be able to take care of themselves to some extent. And in the process, they learn to do certain things. Even though let's say I may have right-sided weakness, the physical therapist will work me through and teach me how to, do certain things. Put on my shirt, put on my trousers or my pants, to put on my shoes, tie my own shoes. They will find ways through acute rehab to, teach you how to do things. And if we are lucky and we are able to regenerate or regain, our functionalities back, yes, we'll all be happy, right?
Yeah.
Yes.
But in the
Very
meantime,
much.
supportive care. That's what we have to do.
Yes.
In speaking about supportive care, brings to mind the caregiver, whoever is taking care of a person who has had stroke. See, one of the complications is the difficulty with language. We call that aphasia. So language, it affects their understanding, their comprehension, even reading, even writing. So the caregiver, it can be very frustrating to the caregiver, because imagine you have a spouse, you're living your wonderful life, and this unfortunately happens. And sometimes you want to see your partner get back to who they were before this happened, and it does not happen, and it can be very, very frustrating for the person who has experienced the stroke, and for the caregiver too, because it leaves a heavy financial burden on the caregivers, on the loved ones, which is why investing into our health is more important than investing in money. You invest in your health first, so people first, then money or things. So, what use is money when you don't have the health,
Right.
To enjoy it? And so a lot of times we think about investment in money, and but the person that is going to be enjoying the money, we neglect the person, which is ourselves. So let's be mindful of that and provide as much support for, even the caregivers need support too. There are a lot of social groups out there that you know, have a common cause. Usually different diseases have different support groups related to their diseases, where you can hear others who are going through the same experience, how they deal with it on a daily basis, and what community supports are what supports are in the community for you to cope. Because it's not just the person that has to cope, but also the caregiver.
Because the caregiver also has their own ups and
Yes,
downs. They get tired
yes,
sometimes
indeed.
of doing the same thing over and over again and hoping it will get better.
Yeah.
So everybody needs help.
Thank you for mentioning the caregiver. We in this profession, we don't focus just on our patients. We think about the family as well. And oftentimes, one group of people that get neglected is the caregiver. Who cares for the caregiver? Sometimes the loved one is sick, or the loved one suffers something, some big, condition like stroke, and it lets it falls on the next person to invest their all. Their life is actually brought to a standstill, just caring for this person. And often, what we have seen is that we care for this sick person to the extent that we neglect our own selves. Our own health, becomes affected as well, because we are focused all our energy, all our resources, everything we care about, and we don't even think about ourselves anymore, and it's not good. So
we neglect ourselves.
Exactly. Care for the caregiver. Whatever, even if you are the caregiver, take time to take care of yourself as well. There's one more little thing I wanted to add, which is very important, which is the fact that we're talking about the fact that you may not be speaking, your speech will be impaired. That is because the voice box, the muscle within your throat gets affected, which also controls swallowing. I want to stress that, because swallowing is a very complicated mechanism that if it doesn't go well, it might harm you. So when people get stroke, by all means, they take time to evaluate them for swallowing. There's a whole department that deals with that. SLP, speech language pathologist. They take time to they can do rehab as well, with your swallowing and speech. So don't force to feed this person. Seriously, I mean,
force to push the food down.
Exactly. In the hospital, whilst you are trying to bring this person around, do all the critical things to save this person, the family walks in and all they are asking is that has he eaten?
Yeah.
And that's all they care about. And you bring them home and you are going to feed them when they cannot actually swallow. Or even at the blind side, while they are in the hospital, when the nurses are not there, you start feeding them food, because they haven't eaten all day. They are going to be weak. That food can end up going into the windpipe, going into the lungs, because there's a flap there that is supposed to close the windpipe whilst you swallow.
Right.
If that thing is not working well, the food would likely go into the lungs, and that will cause aspiration pneumonia, which is even
worse.
something you don't want to add on top of that.
Thank you. So someone is asking, thank you viewers for your comments. So somebody says, apart from calling 911 when you notice someone is having a stroke, is there anything else to do? And I think doctor said you make sure you stay with the person until help comes. So that's another thing to do. Is there anything else? Or that's it?
Deacon, was there anything else?
Yeah, for stroke, there's pretty much not so much you can do. I don't know if the guidelines ask you to take aspirin. Please don't. I mean,
no.
Stroke, take the person, because stroke itself, even though we've seen the signs, it has to be actually diagnosed, right? Because there are symptoms of certain things, drug overdose and stuff like that, that might look like stroke. Yeah. Plus, so after they diagnose it and see the kind of stroke, then you can decide on the kind of treatment. Because let me point something out here. The two types of stroke, we talked about hemorrhagic stroke and ischemic stroke. They are almost opposite each other. Whilst one of them is a blockage, a clot, the other one is a bleed. And so if you don't know which kind of stroke, and let's say you go and chew aspirin, which would prevent clot, you are going to exacerbate it if it is a hemorrhagic stroke.
Yeah.
So don't do anything, just call 911.
And stay right there.
And then stay right with them, give them every support you can. And one key thing, remember the last time you saw this person doing the normal things they normally do. The last time you saw them. We need that time very, very, very much. Because, you want me to tell you why?
Yeah, tell us.
Right. So if it turns out to be ischemic stroke, there are treatments. The treatment that you go through, they can, doctor talked about ischemia, the blockage. This blockage would have to be, if it is a clot, we can give you medications that would dissolve the clot. We can do something that will go in there, they call them clot busters, TPA, that breaks down the clot. So they want to make sure that this is an ischemic stroke.
Very important.
And then when they do the diagnosis, or the diagnostic test they will do, they may locate where the clot is, they may, whatever it is, once they rule out it is not hemorrhagic stroke, then they can do this TPA therapy. However, the TPA can only be brought in if the stroke has happened within 3 to 4.5 hours. That is the only window where the TPA can be used. So that is why you need to know the time. When was the last time this thing started? So when you go to the hospital, when they come, they would ask you that question a million times.
So they'll ask, it's like when you notice it was happening, you time.
Yeah, when it started.
Note the time.
Know that,
roughly.
it's been an hour since
exactly.
we've been waiting for you.
Exactly.
Okay.
That ties into the time. That is why timing is very key.
Fast.
When it comes to, fast.
I remember that. I hope
very key in when
my
you're dealing with
viewers
stroke.
remember that too.
Yes.
So if there's something else you would like to tell our audience, what would you like to say? I had wanted to ask about, since you're talking about the fact that sometimes stroke is cured, sometimes it's not. You didn't talk about prevention. Can it be prevented?
Yeah.
Who wants to take that?
I think you talked about some of the preventive.
Yeah, I think we've touched on a few of them. But yes, it can be prevented in some situations, unless, of course, and because even in the situations where, let's say, something that you don't have control over, let's say your age, because age, people who are 55 years old or more have a higher chance of developing stroke than younger ones, being African American. But those are risk factors you need to be aware of, but there are things that you can do to prevent. So we talked about the high blood pressure, that's one. Just getting your blood pressure under control. So how would you know that? It's important to know your baseline. I know there's some people out there, because I have seen them who've never taken their blood pressure before, ever. I've met people like that. You need to know your baseline, because you wouldn't know if your blood pressure is high, if it's fluctuating, if it's rising, persistently rising, you wouldn't know. So you need to know that. And having a blood pressure monitor at home is important, and also doing your annual wellness visits. Your annual physicals are very important, because they always get a good report on you, head to toe yearly. Also, having low cholesterol. So foods, staying away from foods that increase your bad cholesterol, which is your LDL, because it is the buildup. Remember, we said the buildup of plaque causes the blockage. And plaque is a fatty deposit, a buildup of fatty deposit. And so staying away from those foods, but then eating foods that promote your good cholesterol. So like avocado is a very good one, blueberries, almonds, olive oils. These are foods that promote your high, your HDL. So you want that high, remember you want your bad cholesterol low. And staying away from saturated fats and trans fats, any foods, the fried foods and all of that, cut down on that. We talked about the sleep apnea, so if somebody has the condition, usually they work with a doctor, and they give them a device that helps them breathe better. Controlling diabetes, I think we've touched on that as well. Your diet, your exercise. So your diet, your olive oils, we call it the Mediterranean diet, your olive oils, your whole grains, your vegetables, your fruits. And there's one other thing I'm forgetting. Make up your Mediterranean diet and just vegetables. Just be mindful of what it is that you're eating, because if you realize a lot of the things that we're talking about are things that we have control over.
So, yeah, that's a good point, and I want to segue this into it because we have TIA and even post. One thing we didn't say is that even if you never had TIA but you had a stroke, a major stroke, then you survive, your chances of getting another stroke is very high. So if you are prone to this, the doctors know what to do. You have to stay on top of that. Take your advice seriously, whatever they ask you to do. Typically, they would put you on some medications. One of them is called like anti-platelet medications. So platelet are this part of the blood cell component that stick together to form clot. They help to and they are helped by other protein factors. So there are medications to control these two. If let's say you suffered from ischemic stroke, or maybe you threw a clot and stuff like that, then going forward they're going to put you on medications to make sure that your blood doesn't clot easily to cause some of these things. So they will give you antiplatelets. Antiplatelet, the biggest commonest one you see around is aspirin. They like it because it's cheap and it's effective and it's readily available. You are likely going to stay on that. Let's say after a TIA or after a first stroke, which you run away with, you're going to be on that medication. You could also be on anticoagulants. Those are, like I said, the protein factors that also helps in clot, that function in clotting. They have medications to control that. You can think about we have modern ones, new ones. What do you call it? Pradaxa, Eliquis. There are a few ones that are in the market now, but the old ones like Coumadin is also there for you. The thing though, once they put you on these medications, what you want to look at is that it means that you want to be careful not to get cut easily, because these medications are preventing your blood to clot.
From clotting?
From clotting very quickly.
Okay.
So if you
get a cut,
you
bleed for a long time.
You bleed a long time.
Easily,
Don't bounce your head. Don't play some games that would hurt you. You might hit your head against something and bleed inside. Yeah, so be careful with that. And by all means, if you want something like Coumadin, then you have to monitor your INR levels, some levels, numbers that they will let you know. But you have to go to the doctor or to the Coumadin centers every now and then to draw your blood to make sure that your number is within some range. So those are things that I want you to know, that they might put you on some medications, but they will give you anti-cholesterol medications, they will give you anti-hypertensive medications. You have to start, being very religiously sticking to that so that you prevent any further damage.
Wow, thanks so much, Dr. Kumsen and Deacon Gatti. We have enjoyed our time with you. And thanks, viewers, for your comments. See, even the viewers are saying their thank yous. So they've enjoyed having you here. God bless you for coming. And next week will be the last week we will have our health. This is our health month. Yeah. So next week we'll still have Dr. Kumsen and Deacon Gatti in the house to bring us some more health tips. Please make sure that you do not miss out on these health tips. Thanks also to Lean on Jesus Foundation and Ministries for your support. Thanks to Ashon Collections for your support. Ashon Collections, if you want to reach them, you have 024-354-8925 or 027-638-0091 for all your electronic supplies and gadgets. Also, thanks to our technical team for a great job. We really, really, really appreciate all you do. Thanks to El Shaddai International Market. Please make sure you patronize El Shaddai International Market. The telephone number is 443-274-2094. Address is 2620 Annapolis Road. And as you can see on the screen, yes. Also, thanks to our national head, Apostle Amoakon, and our regional head, Apostle Asemno. And thanks to the district pastor and his wife, Reverend Elvis Boateng and Mrs. Beatrice Boateng. Thanks to our viewers. Next week, same time, on Empowerment Hour, and we will bring to you more of our health topics. Yes. So remember to come to us on Facebook. Let us know what you would like to hear about, and we're bringing it to you on Moment of Truth. This is the truth about stroke. Play it over and over again. Share it with your friends, and see you again same time next week on Moment of Truth. Bye for now.
Thank you.
Bye.